Hello, ladies and gentlemen. Welcome to Health Life 360. I am Dr. NIK NIKAM, and along with Sudhir Maturia, we are going to talk to you about how to enroll in the right Medicare Advantage plan in your local area. It is a pretty complex process we're going to walk you through as how we work on getting you the right Medicare Advantage plan. And here is our contact information. We are located in Houston, Texas, and we can serve practically anyone in the country. As you know, we have the traditional Medicare, which involves Part A, Part B, which you have to subscribe to, and Part D, which is a prescription plan, and a supplemental insurance known as a Medigap, which covers the deductibles and copays which Medicare Part A, B, and D does not provide. On the other hand, we have the Medicare Advantage plan, which sort of combines Part A, Part B, and Part D, where you don't need a supplemental insurance, and that pretty much covers everything under one roof. Most of these include the prescription plan, namely Part D, and some of them may not have a prescription plan where you may need a separate prescription plan. But we're going to focus upon how to determine which is the right prescription, which is the right Medicare Advantage plan for you in your locality based upon your needs, your diagnosis, your drugs, your doctors, and the hospital services that you use routinely. Before you enroll into a Medicare Advantage plan, you need to be enrolled into Medicare Part B. When you become eligible for Medicare at age 65 or earlier, depending upon the medical condition, you are automatically given Medicare Part A or enrolled in Part A, and you don't need to specifically enroll into Part A. However, you do need to contact the Social Security office and enroll in Part B. The Part B premium for year 2022 is $158, and it may go up each year. But whether you are in a traditional Medicare or in a Medicare Advantage plan, you still need to make sure that you are enrolled in Medicare Part B. Once you have enrolled in Medicare Part B, we're going to talk about Medicare Advantage plans. First looks. Medicare Advantage plans offer several extra benefits compared to the traditional Medicare Part A, B, prescription plan, and supplemental plan. The additional advantages offered by Medicare Advantage plans include dental coverage, hearing, and also some vision coverage. In addition to that, it provides some gym membership, some transportation, and travel expenses, things like that. So Medicare Advantage plan streamlines your process of Medicare insurance. It reduces your cost, but also comes with some limitations that you may need to have a primary doctor if you belong to an HMO. You may need a referral, and you may need authorization. You have to see doctors within the network. So those are some of the limitations of the Medicare Advantage plan. But before you enroll into a Medicare Advantage or a Medicare Advantage prescription drug plan, there are a lot of things that need to be done. That's where the healthlife360.com and agents like us come to help you navigate through the process of enrolling in the right Medicare Advantage plan, or MAPD as it is called, which includes the prescription plan. Yes, you can do all the Google search, Dr. Google or Agent Google can get you a lot of information, and in fact we're going to show you how we can get that information. But most importantly, you still need to talk to someone face to face have someone answer all your questions and make sure the plan you are going to get meets all your requirements for the coming year and years later, so that you are not left short-handed. We review your existing insurance, make sure that you are eligible for Medicare or Medicare Advantage plan. You need to be enrolled in Medicare Part B, which I already talked about. We need to review your drugs that you're taking in order to determine what is the best plan for you. Then decide as which Medicare Advantage plan works best for you. If it is HMO, PPO, or fee for service. All of this concern cost, services, copays, doctors, and hospitals, as I mentioned to you already. Then we need to look at the rating of these various private insurance companies that are providing Medicare Advantage plan or Medicare Advantage prescription drug plan or MAPD. Once we determine, then we have to decide based upon your financial situation whether you want to go into an HMO or a PPO. We're going to look at the major differences between these two groups. After that, we complete the application. We answer all your questions. We answer all your concerns. We are interested in your best welfare for the coming years, and complete the application so that you will be having the right form of Medicare or Medicare Advantage plan starting January the following year, which happens to be 2022 at the time of this recording. Okay, so you can contact us at 713-771-2900, or the email is here. But what is more important is we are going to look at certain Medicare Advantage plans and show you how to streamline this process. But that's just part of the story. I want to emphasize it over and over again, because you can look at and streamline the process, but you still need to talk to an agent face to face so that they can answer all your questions, your concerns, and see if your doctors are on the program. In order to do that, we need to switch over to the Medicare.gov website, where we can look at the process of streamlining this. Here we are now here at the Medicare.gov, and we can click on Find Health and Drug Plans. Click on this, then just continue without logging into the program. And let us say there are various options. We're going to select Medicare Advantage plan. That's what we want to look at for your particular case. And put your zip code. I happen to be in Sugar Land, Texas. The zip code is 77478 or 79, and click on that and make sure the county that you are in is checked, because the same zip code can have more than one county. For example, it could be Harris County and Brazoria County. So make sure that you are in the right county. Then we can just say I'm not sure for this last question, then continue without logging in. But if you are already logged into your Medicare website, you can log into your information. And then the next step is to add your prescription drugs so that it will calculate what is the best program for you based upon your drug cost and other features. Initially, this list will be blank. This is a list left over from the previous client we had, which is cholesterol medicine, blood pressure medicine, or heart failure medicine, hypertension, and antacid, and prostate medicine. These are typical medications for Medicare patients. You can delete everything here, or you start off with a blank screen. So you enter the drugs, and when you're finished, you just click Done Adding Drugs. Now it lists the list of pharmacies in your area that have the best program. You select 3 of these, like mail order, Kroger, Walmart, which are closest to your location. Then we click on Done. When you click on Done, it lists the various plans that are available in your area. This list is going to be pretty long, and it is not going to help you to streamline as what is best needed for you. So let's just look at a typical plan, and I'm going to tell you how to streamline this one. Let's say WellCare Texan Plus Classic No Premium HMO. This is a gatekeeper program. The premium is zero, yearly drug premium is zero, healthcare deductibles are zero, and the total in-network cost is $3,400. The services provided include vision, dental, hearing, transportation, fitness, worldwide emergency, telehealth, and specialist $25 copay. So let's say you just want to look at HMO and not particularly PPOs. So you can select a plan here, click on the top here, and just type HMO, click on HMO and apply. Then this will list only the HMO plans. In fact, if you want to look at the ratings, you can go to say, I want to programs that have 4 stars or better, then click on this one. Then it will streamline the list further. We have WellCare, we have Devoted, and we have WellCare Texan Plus another one, Cigna, and Cigna Alliance, and so does the list go on. Again, it is going to be quite complex and intriguing as to how to decide which one is best suitable for you. Because, for example, Kelsey Sibo primarily uses St. Luke's Hospital System. If you are not close to a St. Luke's Hospital System, then it is not a real task because they may approve other places. But what I'm trying to say is after we reach this step, what we can do is, for example, we can come to the top here. You can compare like 3 plans. So let us clean up. If you have done this once, it retains the previous ones. So let's say we want WellCare. All right, we can look at Devoted, and we can look at Cigna Preferred if you like, or let's go to Cigna, the EARP, point of service. We selected 3 of these and then click on compare. Now it's going to compare. Now this is going to compare various plans like WellCare, Devoted, and AARP, which is the United Healthcare. And it says healthcare premiums are 0, drug costs are 0, maximum out of pocket is $3,400 to $3,900. The Part B, which everybody has to pay, whether you are in traditional Medicare or Medicare Advantage plan, and these are all the ancillary services provided by the Medicare Advantage plans. They pretty much match, except for a few exceptions like the copays for specialists and diagnostic tests. Once we have streamlined to this level, this is just the beginning of the process. But this Medicare.gov is an excellent site to sort of streamline and look and see which programs are in your area, which programs cover the drugs that you need, and which programs have the features that you like. For example, this HMO. You can do the same thing for a PPO. Instead of selecting HMO, you can select PPO, then it will list PPO, then you can select 3 programs and compare them side by side. But as I said, this is just the beginning. This is not going to answer all your questions. Dr. Google is not your full-time advisor, and Agent Google is not going to help you prepare your application, even though you can file on their individual website. First of all, you have to determine if your doctors are in the list, if your hospitals are in the list. That is where I think we come into play. That is where our Medicare Advantage plans processed by the Health Life 360 comes into play. We look at your Medicare Advantage plans in your local area based upon your drugs. Then here are some differences between HMO and PPO. First of all, you need to make sure they are 4 stars or plus. And of course, all these companies offer, as we saw in the list. I don't want to repeat the same thing. And the difference between HMO and PPO are quite substantial when it comes to out-of-pocket cost. It could be $3,400 average. It could be $7,000 average with a PPO. And out-of-network is going to be much higher with the PPO. And of course, the co-pays are going to be slightly higher in the PPO group. But in the PPO group, you don't need a referral from a primary doctor to see a specialist or get any tests, whereas with HMO, you need referral for everything that you do. All right, the enrollment period for Medicare Advantage plan is between October 15th and December 7th. That's when you make your selection, you meet with your agent, and you complete an application, scope of appointment, all these paperwork, so that your insurance becomes effective on January 2021. So here are some of the plans: Humana, Wellcare, ERP, Kelsey, Aetna, Medicare, Scott and White. We cover a variety of insurance companies, practically most of them available in our area. Oscar, and we also need to focus upon the prescription drugs. That is very important, because if your drugs are not covered in the program, then you may end up paying much higher premium for your drugs. Once these things are done, you want to make sure you are also covered for your insulin if you have diabetes, so that the insulin costs have been standardized since 2021. So your maximum cost is going to be $229 out-of-pocket cost for each year. Once we have done that, I think the next process is to complete the application form. The application completion is exceedingly important, because this is where we check the hospitals that you use routinely. Make sure that the Medicare Advantage plan has these hospitals in your coverage area. We also make sure that your specialists are in the group. First of all, we need to make sure your drugs are all covered. All your doctors and specialists are covered, and the hospitals that you routinely use are covered. Once we have made all these choices based upon your personal individual requirements, we determine as which is the best HMO or a PPO suitable to you, again based upon your financial resources. Then we complete the application form on your behalf, so that you will have coverage starting on January 1, 2022, as of this presentation, or the following year. So ladies and gentlemen, this is a very quick overview of how to enroll in the right Medicare Advantage HMO or a PPO plan. But this is just the beginning, and we can help you walk through the entire process and complete your paperwork. So please do contact us at insure@healthlife360.com, or you can call us at 713-771-2900. And I am Dr. NIK NIKAM, and we will see you in the next presentation.